as far as setting goals for patient visits, then sounds like should I set a goal for 100 visits a week or 150, and how far out?
Well, the goal you should shoot for is the goal that's going to max you out.
Okay.
Now, you don't know that yet, I don't think.
Yeah.
Like,
I
like I'll
think
give you an example. Like me, I took it up to, I just kept pushing, pushing, pushing until, I was seeing 100 patients a day and I hated it. I hated it. It was like a bell to ring. I wanted 100 a day, okay. But it just physically, emotionally, I wanted nothing to do with seeing that many patients. So for me, and what I found training associate doctors and all, I found like for me, my my real comfort zone was 200 to 240 a week. I could do that week in and week out. But I found most doctors are between 180 and 220. That's what I found they're kind of at.
yeah, and I averaged 150 for a while. I hit 180 once. Then I felt pretty maxed out, but at the same time, I was very frustrated because I was all pay per click and the crappiest patients you could
Yeah.
imagine
So
for
having
900
said
bucks
that,
a pop.
yeah, having said that, if I were you, I'd go, you know what? I'm going to do 180 and I want my prepays over 50% and I want proactive referrals over 50%. And I'm going right to associate doctors from that point on.
Okay. And
And
how?
then after they're trained and you get them up, then you obviously back down if you want to work 3 days a week and only see 150. So I think it's pretty easy to see 150 visits a week working 3 days a week.
Yeah.
I think that's like not difficult at all.
Yeah.
I think once you get over 150, it pushes it 3 days a week.
Did you do like Monday, Wednesday, Thursday, or would?
The three main days when you see patients. So it depends if you're open Friday afternoon or not.
Okay.
But yeah, it's the three main days when you see somebody 3 days a week.
Gotcha.
And then the next step is to you go from there part time. And then even if you want to do 100 visits a week, I mean, look how easy it would be to see 100 visits a week, 3 days a week. Knowing if you know what you're doing.
Right.
So you could even work part time. You could say, I'm only going to work in the afternoon patients. Now your office stays open full time. It doesn't cut down.
Right. Once the associate's there for sure.
Yeah, like I went full time and then I went part time for 2 years. And then after I hired my second associate doctor, I'm like, no, I totally stopped practicing altogether. I didn't even come in 1 day a week. I came in, but it was for training and management and all that. It wasn't for treating.
Right. Yeah. And I mean, we've talked about the stuff I've gone through. I wouldn't mind not practicing, to be honest, but
Well, it's better, like anything, it's better when you don't have to.
yeah.
It makes a big, and I say this all the time. The doctors that go down to 3 days a week, they get more excited about chiropractic because they're not burnt out.
Yeah. Right. Yep.
So
So if we were to say 180,
uh,
I'm right now, before getting all these newer patients through the day four, I'm at about 55 a week is the last several weeks in a row.
if I were you, I'd shoot for. I'd want to hire my first associate in 6 months.
Okay.
I want to get up to 180. I want 50% referral rate. I want 50% proactive new patients, and I want that within 6 months.
Okay.
With the whole goal is within 6 months, 4 to 6 months, but definitely by the 6th month, you're advertising and hiring an associate doctor. In
Okay.
other words, you're stable in all your systems.
Yeah.
You know how to create an abundance, and all your systems are in place.
Okay.
Then it's rinse and repeat.
Yeah.
There is a learning curve of learning how to hire and train and manage associate doctor. There is a learning curve in that,
Yeah.
and it is more than what you think it is. It's more than employees. But when you do it, in our system, it's way easier when you do it like we do it. And then, to be honest with you, then it's rinse and repeat.